want to explain what it is about Nurse Voss that I finally understood in March, because I had been watching her for 8 months without being able to name it, and then something happened in the oncology step-down unit that named it for me. I am the day shift ward clerk on the 4th floor at Harmon Regional. I have been in this position for 11 years. I sit at the nursing station from 7 to 3:30 5 days a week, and I watch everything. You see things from a ward clerk's position that doctors and nurses sometimes miss because they are moving. I am stationary, and the floor comes to me. After 11 years in this position, I know a good nurse from a great one, and I have learned to tell the difference between someone who does the job well and someone who is doing something else. Nurse Voss came to the 4th floor in July on a long-term assignment. She was in her early 30s, quiet in the way some nurses are quiet, not shy, just economical, not spending words she did not have a use for. She wore navy scrubs. She had a notepad in her left pocket that she used in a particular way. She wrote down things that weren't in the chart, observations. Not medical notes, we have an EMR for that, but observations. Something she had noticed about a patient's posture at the end of a shift. A thing a family member had said in passing. What a patient ate and what he didn't, when the chart only said appetite decreased. This is not unusual in nurses. Good nurses keep notes. What was unusual was how she used them. She used them for specific purposes that I watched develop over weeks and sometimes months, and the purposes were not always obvious until they paid off. And when they paid off, it was never in a way that was visible from outside. I am going to tell you about Mr. Aldain. He was a 71-year-old man, oncology step-down, post-treatment, waiting on a scan result that had been delayed twice by scheduling. He had been on the 4th floor for 3 weeks when I first noticed that Nurse Voss was spending slightly more time in his room than his care plan required. Not a lot of extra time, a few minutes at the beginning of a shift and a few at the end. She would go in after rounds and again around 1400 when the floor was quietest. I noted this because I note patterns. I did not know what it meant. In the 3rd week of August, she came to me at the nursing station at about 14:15 and asked me to pull a record from the pharmacy database, a specific interaction flag. I pulled it. She looked at it for about 90 seconds, made a note on the notepad, and went back to the floor. She did not explain what she was looking for. The following morning, she was at the chart station before I arrived. When I got in at 7, she was at the computer with the overnight attending, and they were looking at the medication record. I could see from my position that she was showing him something. The conversation lasted about 6 minutes. The attending made a note in the chart. The pharmacy was called. Mr. Aldain's pain management changed that day. Not dramatically. It was a dosing adjustment, a timing, a substitution of one compound for another. The chart note said pain management review. His vitals improved. He ate more at lunch. At 1500, I saw him walking the hall with his daughter for the first time since he had come to the 4th floor. Nurse Voss did not say anything to me about this. She charted what she charted, communicated what she communicated through the proper channels, and went on to her other patients. I watched this happen 3 more times over the next 5 months. Not always the same kind of intervention. Once it was a family communication issue. She had noticed over 2 weeks that the patient and her adult son were not talking to each other the same way during visits, and she flagged it to the social work team with a note that the dynamic had changed and it might be worth a check-in. The social worker went in. What came out of that conversation, I don't know, but the son started coming more frequently and staying longer. Once it was a therapy referral. She had been tracking a pattern in a patient's sleep observations over 6 weeks, not in the chart, in her notepad, and she brought it to the attending as a question. Had anyone considered whether this pattern might indicate something worth a referral? The attending asked what she meant. She showed him the notes. The referral was made. I do not think any of these interventions were dramatic. I do not think any of them would have made a good story in a medical television program. They were the accumulation of careful attention over weeks and months, turned at the right moment into a specific suggestion to the right person, through the right channel. In March, I understood what I had been watching. The moment of understanding was this. I was at the nursing station and a family member came to the desk, a woman in her 40s, daughter of a patient in room 412, who had been on the floor for 6 days. She said she wanted to speak with someone because her father had said something the night before that worried her. She did not know who to tell. She said it to me because I was at the desk. I said I would find Nurse Voss. I had not planned to say that. It was simply the name that came to me as the right answer to this situation. I found Nurse Voss in the medication room. I told her there was a family member at the desk who wanted to talk to someone. I said I thought she should be the someone. She came with me without asking why. She sat down with the daughter at the end of the nursing station, where there was a bit of privacy, and she listened for about 12 minutes while the daughter talked. She asked 2 questions. She said she would follow up. She got up, went back to the medication room, finished what she had been doing, and went to room 412. What came of that I also do not fully know. What I know is that the patient in 412 had a new note in the chart that afternoon and a consultation the following morning, and that the daughter came back 2 days later and asked specifically to speak with Nurse Voss, and the conversation was brief, and the daughter left with the particular expression of someone who had been told something honestly and found it easier to carry than what she had been carrying before. What I understand now is this: Nurse Voss is not primarily a nurse who treats medical conditions. She is a nurse who watches people, accumulates what she notices, and then at the right moment does the specific thing that the situation requires. The thing is usually small. The thing is always right. In 11 years I have worked alongside many good nurses and several great ones. The great ones are usually visible. Their competencies are dramatic. Their saves are known. Their presence is felt. Nurse Voss is not visible in that way. Her work is invisible almost by design. The interventions are always attributed to the attending who made the call, or the social worker who followed up, or the pharmacy team that made the adjustment. She would say this is how it should be. The one time I said something to her about what I had been observing, she looked at me with the level expression she used when she was thinking, and she said, "The point isn't who does it. The point is whether it gets done." Then she went back to her rounds. She still has the navy scrubs in the notepad. In March, she started a new notepad because the old one was full. She transferred the active observations, the things that had not yet paid off, from the old notepad to the new one. There were 11 of them. I watched her do it. I thought, those are 11 things that will get done. I was not wrong.